Assalamu alaikum. Let's talk about Fragile X syndrome. In Fragile X syndrome, there is trinucleotide repeat expansion of FMR1. FMR means fragile X messenger ribonucleoprotein. Fragile X messenger ribonucleoprotein. In here, there is gene methylation, which prevents transcription and translation, thus prevents protein production. So it prevents transcription and translation and thus prevents protein production. It is an X-linked dominant. There are other, can you tell me the other X-linked dominant? If you know, put it in the comment box. What are its feature? There is neuropsychiatric feature like developmental delay, intellectual disability, ADHD, autism spectrum disorder. There may be self-injurious behavior, hand biting, and anxiety. On clinical examination, there may be long face. In Fragile X syndrome, everything is getting bigger. Long face with prominent forehead and chin, large protruding ear, macro macroorchidism. That means the testes become bigger, and there may be macrocephaly. Can you tell me the name of a virus which causes microcephaly? If you know, put it in the comment box. Okay, and joint hypermobility. Joint hypermobility like uh, fingers, wrists. How we can diagnose this patient? We can diagnose by fMR DNA, that means fragile X messenger ribonucleoprotein DNA analysis, either by PCR or or southern blot. Okay, look at this question. This 4-year-old boy, there is behavioral difficulty. His speech is difficult to understand. Very important. There is a family history of ASD. But if you look at the clinical feature like deep set eyes, large ear, he is highly active and banging a set of toy trains on the floor like ADHD type of feature. Looks like Fragile X syndrome, FMR1 gene mutation. This is the normal FMR1 gene, and this is silenced FMR1 gene Fragile X syndrome. There is methylation extending to the promoter. This is promoter area where actually transcription begins. So there is methylation extending to the promoter. Okay, I'll look at the physical feature, intellectual disability, neurobehavioral issues, prominent forehead, large ears, prominent forehead, large ear, long, narrow face, prominent chin, and there is macromorphism, looks like Fragile X syndrome. So, Fragile X syndrome is a very unique topic, and there are some like think about when you find a case, think about other disorder like other karyotyping disorder such as Down syndrome. In Down syndrome, there is like brush filled eye spot, epicanthic fold, upslanting, palpable fissure. There is low set ear, but in Fragile X there is long, large ear, and in downs like single transverse palmar creases, single transverse palmar creases, there is hypoplastic inverted fifth finger, and there is sandal toe deformity, and it is diagnosed by karyotyping. So this is a small topic, a very unique topic. Hope you enjoyed.